This is a quick book review of Healing Back Pain by Dr. John Sarno. I read this book a few months back and I found it very interesting and insightful that I could use in my life. None of what I summarize here is an advice. Definitely talk to your doctor before acting on any of these advice or summaries mentioned in this video. So, getting into the book, who is the main audience of this book? I think everyone, but mainly people who are in their mid 20s or 30s trying to prove out something in their life, trying to prove themselves, trying to accomplish something, working really hard, long hours, hyper responsible, ambitious, and dealing with a lot of stress. When you're dealing with a lot of stress, there are going to be emotions that are suppressed or repressed. That's the core idea, I believe, of this book, which is repressed emotions. When there are emotions that are not taken care of and the mind is not able to deal with them, the mind's attention is focused on that upset emotion all the time and it's miserable. So it tries to do something. And what does the mind do? Mind talks to the brain via the autonomous nervous system and causes oxygen deprivation in the muscle, which is called TMS, which is another core concept of this book called tension mitosis syndrome. The oxygen deprivation is caused by the brain, which causes pain in the muscle. So mostly one big characteristics of this types of pain, not just in the back, but also on the neck and buttocks, is that the pain shifts over time. It's not that the pain remains at the same place. You would have noticed that the pain changes where it's paining. So, and it's all because of the mind's neural pathway that the brain establishes because of oxygen deprivation. So, basically, when the mind's attention is moved from those unbearable emotions to the pain in the body, it's acting as a temporary pain killing strategy. The mind's able to not have to think about those emotions because it's constantly busy now thinking about the pain in the body. So it's basically a pain killing strategy. And per this book, it causes through oxygen deprivation, through the use of the brain, and use of autonomous nervous system. So in summary again, this happens usually when there are repressed emotions and the mind is not able to deal with them. And the person who's facing these pains that keep shifting is not able to deal with their emotions. There are various ways of coming out of this. Um, some of them are mindful meditation, actually dealing with those emotions that are not bearable, remembering all the activities where you had pain emotionally in your life. A physical pain or a MRI that is not right doesn't necessarily relate with the pain. Most people have abnormal MRIs but have no pain. So it's just a trigger, like a physical accident could mostly be triggers in most of the situations, but your doctor has to be the person who has to rule out that. It's easy for everyone to ask the doctor to fix them rather than them fixing their emotions and fixing their life and all the history of the baggage that they have. So there are various ways of dealing with it and various ways of retraining the mind so that your neural pathways that are formed, which are of pain, are are retrained so that they are no longer painful. Because if it's painful in the mind, that's how it translates to painful in the body for most of these situations described in this book. But there are also real pain. So there are two types, but this book focuses on TMS. Thanks. This was a great summary for me. I have experienced multiple various pains, and I have seen those pains to be transient, and I think it applies to me. But for you, make sure your doctor does gives you the right advice. So make sure you follow that advice. I really like the book. I'd really recommend anyone to buy this book by Dr. Sarno, Healing Back Pain. And remember, there's no easy pill to fix this. If you really want to address your emotions or repressed emotions, then you'd have to train your brain, train your mind through active training. Thanks.